Hi everyone, welcome to my presentation on Tay-Sachs disease. This is all of the topics that we will be covering for today. The first, disease and symptoms. What is Tay-Sachs disease? Tay-Sachs is a disease that is a rare genetic disorder that is caused by the absence of an enzyme called hexosaminidase A. This enzyme is found in lysosomes, which are structures in cells that break down toxic substances and act as recycling centers. Within lysosomes, beta-hexosaminidase A forms part of a complex that breaks down a fatty substance called GM2 ganglioside found in cell membranes. Eventually, the gangliosides build up to toxic levels in the brain and spinal cord and affect the function of nerve cells. Types of Tay-Sachs disease. So there are 3 types of Tay-Sachs disease, which depend on when the symptoms develop. The first form is classic infantile, which is the most common form of Tay-Sachs disease. This usually results in death, and children with the condition usually do not live past 5 years of age. Juvenile and late onset are the rare forms of Tay-Sachs. Juvenile Tay-Sachs is when symptoms develop between the age of 5 and their teenage years, and late onset symptoms can appear during teen years or early adulthood. This type may not affect your life expectancy, but it makes you a carrier if you have children. Symptoms and diagnosis. The most common symptoms of infantile Tay-Sachs disease usually starts when the child is 3 to 6 months old, and these common symptoms usually affect the muscular system and developmental delays. Available treatments. So currently there are no cures for Tay-Sachs disease, and there are no treatments that are currently approved to slow the progression, but there are some treatments to manage the symptoms. So the first one is physical therapy, which can help children keep the joints flexible and maintain as much ability to move as possible. There are some medications to help control seizures and to reduce the risk of mucus accumulation and prevent aspiration pneumonia. Because some children may have trouble swallowing or develop respiratory problems, they can use feeding tubes to prevent inhaling the food or liquid into their lungs. And then potential treatments. There are researches on gene therapy, stem cell transplantation, or enzyme replacement therapy, which may eventually lead to a cure or treatment to Tay-Sachs in the future. Causes and risk factors. Tay-Sachs disease is very rare in the general population, but the genetic mutations that cause disease are more frequently found in people of Eastern and Central European Jewish heritage. However, increased education and genetic testing efforts in these communities have reduced the incidence of this condition. So here are some statistics on Tay-Sachs disease. 1 in 100,000 people are affected. 1 in 250 people will be a carrier of the Tay-Sachs disease, but this frequency is much higher in Jewish communities, being 1 in every 27 people. And then the most common age of fatality is 3 to 5 years old. Diagnostic tests. Some ways to test for Tay-Sachs is through a blood test, which checks the level of the hexosaminidase A enzyme, which is usually low or absent in Tay-Sachs. A genetic test can also be used to examine the hexa gene because this condition is inherited in an autosomal recessive pattern, which means that both copies of the gene in each cell have variants. Prevention. If both parents that are expecting a child are known to be genetic carriers of Tay-Sachs, there is a 25% chance that any of the children will be affected by the condition. Antenatal screening can be used to determine if the fetus is likely to be affected by the disease. One of the methods that can be used is through chorionic villus sampling, which uses a cell sample from the placenta that is tested for evidence of the disease. And then pre-implantation genetic diagnosis is similar to IVF, in which the ova is harvested and they are fertilized by a father's sperm in a lab. These embryos are then tested for Tay-Sachs, and those that are unaffected will be implanted in the uterus for the pregnancy to continue. Disease biology. Tay-Sachs is caused by mutation in both alleles of the gene hexa on chromosome 15. Hexa codes for the alpha subunit of the enzyme beta-hexosaminidase A. This enzyme is found in lysosomes, which are organelles that break down large molecules for recycling the cell. Along with the enzyme deficiency, we can also see the swelling of neurons and the accumulation of lipid in retinal ganglion cells, which leads to a red mark on the retina called the cherry red spot. And then here's a brain scan of a 5-year-old child with infantile onset Tay-Sachs. We can see the cerebral cortical and cerebellar atrophy and diffuse white matter in the images, which indicate damage to the myelin sheath. Pop quiz. Now, which of the following is not true regarding Tay-Sachs disease? I give everyone a minute to decide. Okay, the answer is A. This disease is not caused by a dominant lethal allele, it is caused by a recessive one. Here are my resources. And thank you so much for watching. I hope you all learned a lot about Tay-Sachs disease.